Hello, this is Dr. Steve Hotze, and I'm here to answer the Facebook question of the week. It was asked, Doctor, I seem to be getting sinus infections every fall, several times. Could this be allergies? And the answer is unequivocally, yes, it is allergies. The weed pollen season occurs during the fall, and the most common is ragweed, but there are numerous different weeds that adversely affect a person with allergies. An allergy is an abnormal reaction by your immune system to normal occurring substances in the environment, like weed pollens, tree pollens, grass pollens, dust mite, mold spore, and animal danders. So in the fall, we have weed pollen season. And what happens is the person who has a genetic predisposition towards allergies will make an antibody towards these allergens as if they were a virus or a bacteria. Other people without an allergy predisposition don't do that. And when these antibodies are made, every time they are exposed to that specific allergen, that airborne weed pollen, they react to it, and it causes their mast cells, which line the mucosal membranes of the nasopharynx and the lungs, to secrete fluid, which is why we get this chronic catarrh, this drainage. And it becomes a culture media for bacteria. The next thing you know, you have a secondary bacterial infection, and you go to the doctor and he puts you on antibiotics, and you get the infection cleared up, but you continue to have the allergies, which weaken your immune system and predispose you to secondary infections. So what do you do for it? Well, of course, if you have the infection, you treat that, but the goal is to not get the infection. So to prevent getting the infection, you've got to control your allergies. Some people try to do that with medication. That doesn't treat the underlying problem. We find the best way to do it at the Hotze Health and Wellness Center is to test for the common allergens in the environment and determine at what level an individual is sensitive, and then provide them with allergy desensitization drops. So rather than giving shots on a weekly basis, we give sublingual drops under the tongue on a daily basis, which you can take at home. You don't have to come into the office. And that builds up blocking antibodies to block the airborne allergens and to prevent the secondary infections that occur. I hope this answers your question. And be sure to write, and I'll be glad to answer your questions on a weekly basis.